my 3 years of gym training that helped me to, become a runner. My snoring improved, my sleep apnea improved, my sleep improved, and I was able to, concentrate more on my work.
Correct.
My productivity increased on my professional front. My motivation is to keep my heart and my body healthy.
Correct.
So that, I can sustain it for a longer duration. So I finished my 100 days of running without missing any day, and I completed 750 kilometers.
Hello everyone, welcome to Run Play Go, the moment where we explore what it means to live through sport, purpose and movement at any stage of life. Our guest today wears two hats, one in the ICU and one on the racecourse. Dr. Ramit Wadhwa is a leading consultant in non-invasive cardiology at Fortis Hospital Gurugram, with over 12 years of clinical experience in advanced cardiac imaging and care. But beyond the hospital, he's also a passionate ultramarathoner who's run from Gurgaon to Jaipur, served as medical director at the Gurugram Marathon, and been part of over 100 Medivac airlifts. Today he joins us to talk about a subject close to both our hearts, literally. If you're someone who started running or training in your 30s, 40s or beyond, or want to, this conversation is for you. We're talking about cardiac health, fitness myths, performance markers, and how to protect your heart while chasing your next personal best. Let's dive in. Dr. Ramit, welcome to the show. It's a matter of great honor and privilege for us to have you on the show with us today when we talk about all things endurance and heart.
Thank you so much, Shivani, for warm introduction and giving me this opportunity to, interact on this platform. So I'm looking forward and hope we have a very interesting session.
Absolutely.
Heart and health.
Absolutely. Can't wait to dive in. So before we dive into this science part of it, tell us about your own journey and how did you go from a full-time cardiologist to an ultramarathoner?
So my fitness journey, it started in, I think 2014. So I was sort of very obese and had all lifestyle diseases I can have, metabolic syndrome. I had a high blood pressure, my insulin resistance, sugars were little abnormal, lipids were all sky high, and I had a very bad family history of heart disease, of diabetes, hypertension, and then I was also suffering from sleep apnea, loud snoring. So I was going through a tough phase in my life. So at that time, then few of my friends, they were doing gym and I saw them transforming, losing almost like 10-12 kg weight, and they were looking more fitter.
Wow.
So I asked them that how did you, they told me nothing, you just come and join us in the gym. So for 1 month, I always asked, gym join karna.
Correct.
So finally, I went and joined gym, and first day was very tough. When I hit the treadmill, I was not even able to walk for 5 minutes at 5 km/h speed.
Wow.
So my heart rate was going above 170. I was feeling breathless. Then my trainer told, sir, today is the first day.
Yeah.
Relax.
Yeah.
You have to give time.
One step at a time.
Yes.
Yeah.
So, so my journey didn't start with running.
Right.
So I was more into strength training, and I lost around 7-8 kg by doing cross trainer. So I did cross trainer a few years back. I know I could do it. So I started with 10-15 minutes of cross trainer and then body weight exercise and then strength training.
Correct.
So for the first 2-3 weeks, it was sort of a warm up session, and then slowly I shifted to a specific body part on a day. Correct. And I used to do 20 minutes of cardio, and I used to spend at least 1 hour on and gradually building up my base. And I used to do with the very light weight and started gradually increasing my weight and reps and everything. So in 7-8 months, I lost around 10-12 kg weight. My BP came down.
Wow.
Drastically. I used to stay with the 3 medicine, it used to over around 140-90. And then suddenly, my basal heart rate, which was more than 100, it came down to almost like 60.
Wow.
50. And my
Wow.
BP used to remain in the range of 120 by 70. Then gradually, I weaned off my all the
medications that you had.
yes. And I was having, signs of insulin resistance. I was having hyperpigmented patches over my neck. They all disappeared.
Wow.
They all disappeared. My snoring improved. My sleep apnea improved.
Wow.
My sleep improved. And I was able to, concentrate more on my work.
Correct.
My productivity increased on my professional front. And, it just changed my life.
Wow.
And so only thing which was good was I was consistent.
Absolutely.
So I used to carry my bag with me in hospital. From hospital straight, I used to go to gym. And night, I used to reach home by 10 p.m.
Wow.
And next day, if I had 24 hours duty, I used to go to gym morning at 6. I used to do 1 hour gym and then go for my 24 hours duty.
Incredible.
So that was the passion,
Yeah.
So only if you have passion,
Yeah.
you can achieve anything you want to do.
Absolutely.
And then gradually, I started running.
Correct.
So it took me almost 7-8 months to run continuous on a treadmill for 20 minutes. I used to cover, say, 2 kilometers in 17-18 minutes.
Wow.
And I used to feel, wow, man, Ramit, you have done it.
I'm a runner now.
Yes.
Yeah.
So running was something which, which was a distant dream for me.
Yes.
Because I was hardly able to, do walk, jog for 5-10 minutes.
Correct.
So it was that bad. So gradually, for 3 years, I did strength training. And, it just totally transformed. Yes, everything, all my medicine, all my blood parameters improved.
Wow.
My BP, everything.
Correct.
They were like, and before joining gym, I went through all the medical tests. Even I underwent CT coronary angio also.
Yeah.
Because I was having a bad lifestyle, so I just wanted to check whether I am having, any underlying cardiac disease or not. So after that, I started my, so that was my 3 years of gym training that helped me to, become a runner.
Absolutely.
So one of my senior colleague in Medanta, Dr. Karthike, so he is very close friend, and he was the one who inspired me and who motivated me to run 21 kilometers.
Yes.
So we made our own running club at that time.
Correct.
And my first 10 kilometer credit goes to Dr. Karthike.
Wow.
We went to Leisure Valley in the summer, in the month of July, which was very humid. And I ran my first 10K.
Wow.
And I was not able to believe that I ran 10K kilometer non-stop.
Correct.
So that was my 10K. And then there was no looking back.
Then there was no looking back.
Yes. And then I did my, then I came to know that ADHM is happening. And then he only helped me in registering a, 10K event.
Correct.
That was a qualifier event. Then I did my first ADHM.
Correct.
And my timing was 2 hours, 2 minutes.
Wow. That was your first, that was your first half.
Yes.
Incredible.
So I think it was all because of my strength.
Yes.
It was all because of my gym.
That was the base.
Yes,
which
because
was built.
I used to do 2 hours of gym. I used to do 2 body parts every day.
Correct.
I used to almost say there was no rest day.
Yeah.
So on rest day, I used to do only cardio. So 7 days gym. My bag used to be full of whey protein, amino, pre-workout.
Wow.
So I had that kind of passion for my gym.
This is almost like a life change that you have
Yes,
at that time,
absolutely,
That
absolutely.
pre and post phase.
Yes.
So
I think this is the motivation for me to, for my sustainability.
Correct.
Because I'm not very ambitious about, I have to run at this pace or I have to qualify Boston. For me, my motivation is to keep my heart and my body healthy.
Correct.
So that, I can sustain it for a longer duration.
Absolutely. And that's how basically this is how you became a doctor who runs. So Ramit, very interesting, some of the anecdotes that I've heard over the last few years about you. One of them was about running from Gurgaon to Jaipur for a cause. Even when we hear about it, it's a large distance, right?
Yes.
And it can't be, and it wasn't even an event. It was done for a cause. So what motivated you to do that? And what did you learn about your heart and mind on that journey?
So when I ran my first half marathon, I joined running, coach Sumit. I joined his pit. So, and then then I came to know so many humble and nice people, and they became very close friend of mine.
Yes, yes.
So I think that community we made, so that helped me in pushing me to beyond my limits.
Correct.
So we all used to push each other. So after running my first half, they told, now we have to run a full marathon.
Correct.
It is happening in February. We have 4 months. We'll prepare. We won't target any time. We'll try to finish it off. Then that gave me a motivation to run 42 kilometers. We trained together. Then I ran my first 42 in 2019 January. That was New Delhi marathon.
Wow.
So from 10k to 21 and then 42.
And then straight 42.
42. And then for entire year, then in summers I joined that 100 days running club.
Right. Yeah.
So
consistency.
Yes. I wanted to maintain a consistency in my running. So every day minimum I used to do 2k or maybe 5k. And during those, I still remember during those 100 days, I covered around 750 kilometers.
Wow.
So I finished my 100 days of running without missing any day, and I completed 750 kilometers.
Incredible. See, this is what I think. Running is a journey that once you take your first step, after that, the journey just carries you forward.
So it takes 21 days to 30 days to form an habit.
Absolutely.
And in 100 days, it becomes part of your life.
Then you are a thorough runner.
Yes.
Absolutely.
Yes.
So tell me, do your patients know you run?
Few of my patients, they know because I motivate them with my story. So I come across not many patients, young patients, those who are suffering from lifestyle disease. So I tell them my story.
Correct.
So they know what I'm preaching, I'm practicing also.
And that's what I was going to ask next.
And that's what I tell them, that I want you to get rid of these drugs. And the only way to do it is to maintain healthy lifestyle.
Self-example.
Yes.
So, in fact, that's what I was going to ask you, that has it made any difference in how they relate to your advice? So when they see you and when you tell them that, you should not be doing this in terms of lifestyle changes.
I have my pre and post photograph with me on my phone. I always show them this.
It's a live example.
So all your 3 diseases, I was also suffering.
Correct.
And you have to make your mind. You have to be passionate about it, and you just need to spend 1 hour on it.
Correct.
So what science says is, if you are doing 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise in a week, cumulative, I'm telling you, then you will get all the cardiovascular benefit of exercise. And those who are practicing it, maintaining a healthy lifestyle, they have 40% less chance of getting a cardiovascular event than as compared to the person who is having a sedentary lifestyle.
It's all about the lifestyle.
It's all about,
and it's all about the lifestyle on everyday basis.
So there are, there are many modifiable risk factors. One is smoking. One is alcohol. One is then your lifestyle disease like blood pressure, diabetes, sedentary lifestyle, stress. So these are the risk factors which we can take care.
Which we can control. These are the variables in our control. Absolutely.
Genetics, obviously, we cannot control. But if we are able to control 6 or 7 modifiable risk factors. Sleep, stress, and all the factors. Sleep is a big factor,
Absolutely.
Your body needs good sleep for your mental recovery and your physical recovery.
This I have discovered in my own journey as well. Sleep, I think, is the unifier of all the other factors that we speak about.
So now I make sure that I go to bed by 10:30, and then I'm up by 4:30. So I want that hours of sleep.
Correct. So and you are a great example of starting late. A lot of us think that you're an athlete if you started the journey in school, and there are quite a lot of them. Also,
absolutely.
But then there are quite a lot of people who start the entire endurance journey, maybe in their 30s, maybe in their 40s, and I'm also seeing now in their 50s.
50s, yes.
For the first time they've played any sport or they've started running.
Because
in their 40s and 50s.
Because those 20s and the 30s decades, they go in
Correct. We are busy doing other things.
busy doing towards your profession, towards your education.
Correct.
And by the age of 38, 39, 40, you are almost, settled in your profession. You have your own business, you have a job.
Correct.
And so I think that is a time when, you are more responsible also. You understand, the impact of unhealthy lifestyle also.
Yes.
So I think those are the triggers. And now, since many people are, getting aware about what is the importance of active lifestyle, so many events are happening nowadays. You see, in 2015-16, we hardly used to see any runners in the morning. There were no groups at all. I still remember when I was preparing for my New Delhi Marathon, there was hardly any group here. We used to, I went to Dwarka for a promo run for my, to do my...
And to train together.
Weekends.
Yes, absolutely.
So because only weekends were are for us where we can do a long run, we can do our training.
So, for every recreational athlete, and that's who we are, so let's say somebody who's above 35 and starting now, what are some of the tests that they need to be doing before they start? Or, what are some of the other do's which are required before they start playing a sport seriously or they get into running seriously in a structured manner like we do? So do you recommend some of the basic testings?
Yes. Bilkul, if they want to start their journey after 35, 40 years of life, and this is an endurance sport, if someone is planning to do a 21 kilometer, it is not an easy job. And they have to undergo rigorous training for it. So first of all, they should give themselves some time. They should do a base building by increasing their aerobic base. And now before starting this, they should consult their physician or cardiologist. And they should get a clearance from them, whether they can run or not. So then there are, so the approach should be, they should a proper clinical examination and their detailed history should be taken. Whether there is any history of sudden cardiac death in their family, whether there is any history of young heart attacks in their family. So those will define whether there is any genetic predisposition to that individual, because there are many instances where there is suddenly a patient is all right and suddenly he collapsed and died. So these kind of, there's an entity which is called as the hypertrophic cardiomyopathy. Okay, where the heart muscles become very thick. And the muscles get fibrous, scarred, and which eventually become trigger for dangerous arrhythmia like ventricular tachycardia, VF, and patient collapses. Okay? So that,
and we've seen that.
Yes. And so that is important to rule out. So one is a detailed examination and clinical examination. You can find some murmurs or something. Then a basic ECG, echocardiography. Then stress echocardiography, and also cardiopulmonary exercise testing. So in Fortis, we are doing cardiopulmonary exercise testing. It's an integrated approach where you can you can evaluate their respiratory system, their cardiovascular system, their musculoskeletal system, and their metabolic system. So it gives you a very good picture, comprehensive picture of the cardiac and the respiratory health of that patient. And we drive a lot of information like VO2 max, what is the aerobic threshold of the patient, and with that you can give them a personalized training plan, that what level of endurance they have, and how they should go about preparing for their marathon, what pace they should target, and how they should do their base building, how they can increase their... It is important when you do any endurance exercise, it is very important to have a good aerobic base. And aerobic base always come with the, when you do your exercise on an aerobic slow base building, because then only your, and that helps your fat also to get burned. So I think that should be the
absolutely the bare minimum that one needs to do who's getting into the sport new and who's above, let's say, 35.
So less than 35, again detailed history and clinical examination, and also ECG and echocardiography to rule out if there is any genetic disorder of heart like hypertrophic cardiomyopathy or dilated cardiomyopathy and those.
Absolutely. So what are some of the biggest cardiac mistakes that you come across recreational athletes making?
So one is that they are following some unstructured plans.
Yes.
So they want to start their running journey and straight away they are preparing for 21 kilometers.
Yeah. They want to
Ha.
proceed too quickly.
Too quickly. Yeah. So that should not be the approach.
Yeah.
So they should have a structured approach. A proper coach should be there, to instruct them. First, they should do their base building, as I told you.
Yeah.
They want to start with couch to 5K plan. They start with slowly with the walk, jog, to improve their aerobic base. And then also in 2 days in a week, they should do a strength training. They should have strong muscles. They should have proper strong core, hip muscles, quadriceps, strengthening, and all the limb strengthening should be done. So this is how the approach should be. So 2 days they should give it to strength training related to the running, and rest of the days they can do their runs. Then they can divide their run into 20:80 approach. So 20% of their runs can be high intensity run. So initial phase, so they should do slow only. But once they do their base building for say 12 weeks, then they can start with 20:80 approach, where they can do some sprinting and then rest, some short sprints and then rest, and rest of the days they can do a normal pace run, conversational run, which we call it as a conversational run.
So basically not progressing too quickly. And that's what you see a lot of, new runners.
Yes, and that will lead to injury also. And then another thing, people don't realize the importance of, warm up and cool down. So if you start any exercise, you should do 10 to 15 minutes of warm. That is very important. 10 minutes of warm up, at least you should do. If you are doing, strength training, then also you need some warm up. If you are doing running, then also you need a warm up.
Correct.
And after, you finish your core exercise or you finish your run, you should do a cool down. So warm up, exercise and cool down is very important. And then obviously strength training, stretching, post-run stretching, dynamic stretching before you proceed for your run to activate your muscles, your joints. So you should have this kind of a structured approach when you are,
and there is a cardiac connection also to all of this. So physiologically, I understand.
Yes.
From a vascular system point.
Absolutely. You don't want to. So whenever you are going to start an intense exercise, you need to do warm up. You need to increase your heart rate a little bit. You cannot make your heart beat at 160.
Yes.
So your heart also need an intimation. First, I'm going to start exercise.
Yes.
So you need to do that kind of a warm.
A gradually increase of.
So sudden unaccustomed workout will lead to cardiovascular events.
So apart from this, are there any silent risks? There are some conditions that people might have, which may not come out unless you've done some specific
So if
testing.
someone, suppose he is in middle age and he has been smoker for a long time, or he has been diabetic or hypertension, so he already had some risk factor. He might be having an underlying coronary artery disease, which may be undiagnosed. Maybe he might not have undergone any kind of testing, and suddenly now he decide that he want to run, and he starts doing exercise, running without any clinical evaluation. And one day, if he do some exercise, high intensity exercise, and if he's having underlying heart disease, that can trigger fatal heart attacks. And and that is the most common cause.
Correct.
So it is not that the gymming and running will kill a person. It is the underlying disease which is undetected in that will result in a cardiovascular event.
The moment you put some pressure on
obviously,
heart,
which is your body is not used to it.
Absolutely.
And then it will lead to So I think many people are getting afraid of these kind of events. These events are very, very rare. This event will happen only 1 in 1 lakh in a marathon, or maybe 1 in 50,000 in a marathon. So it is very important to before you start your journey. One is you should start it gradually.
Correct.
And then you should get through a proper medical evaluation
before you get into any serious endurance.
Yes.
So Ramit, let's talk about some of the myths, missteps and monitoring, because we're talking cardiac here. So specifics are extremely important. Can you break down some of the most common fitness myths which are related to heart health, which you see around?
Fitness, I didn't get the question.
some of the most common fitness myths related to the heart health.
So first of all, someone who is fit may not be healthy.
Correct.
So the one who is doing gymming and he is not getting his
Correct.
preventive health check,
Correct.
thinking that I am fit. So that is a myth. He may be having underlying heart disease, and we have seen that many people who are gymmers also, they collapse.
Yeah.
So that is a myth. So one is every fit individual is not healthy.
Correct.
So it is very important that
There's a distinction.
yes.
Huh.
So one is that.
Right.
And then I think obviously when you work on your fitness, you become healthy.
Right.
So fitness and healthy, they are not synonyms, but yes, the better is that you...
They're interlinked.
They are interlinked, yes.
Right.
And you should work towards... So it is important that when you are doing exercise or when you are running, you should try and quit your bad habits like smoking and...
Correct.
If you continue with this, then your, the effect of your exercise will get nullified with those kind of bad habits.
So it has to be a holistic approach.
It should be holistic.
So you have to
to get the maximum advantage of exercise and fitness. It should be a very holistic approach. You should have a proper sleep. You should have you should not indulge into this kind of addictions. Alcohol, is become a part of life, but you should try it as try to avoid as much as possible.
Correct.
And whenever you also have it in a we don't allow anyone any quantity, but still
in a very
moderate, limited. Yes. Binge drinking is very harmful, and it is a cardiac irritant also. There is a syndrome which is called as the holiday heart syndrome. Patient going into irregular rhythm, atrial fibrillation after drinking atrial fibrillation. And now those who are runners, those who have been running from long time, they have a bigger heart, which is also called the athletic heart.
Correct.
Okay, and their left atrium size and they becomes big, so they are more prone to get atrial fibrillation. And alcohol is another irritant.
Correct.
So all these things, are interlinked.
So running and alcohol, in any case, don't go together.
So alcohol will increase your heart rate.
Yes.
Alcohol will increase your blood pressure. So this will impact on your sport.
Performance.
Yes,
absolutely.
Smoking will kill your lungs.
Correct.
It will impact on your VO2 max because you will have a ventilatory limitation.
Absolutely.
Eventually you are going to end up into airway inflammation, and your breathing will get impaired.
Correct.
So this should not go hand in hand.
It's a choice.
It's
a choice. It's a lifestyle choice that needs to be made very clearly.
Yes.
So another myth which many times is spoken to people like us who are regular runners is that running is dangerous after 40.
No, running is not dangerous after 40. But yes, underlying disease, if someone is having, that can make running a bit risky. Okay, so running doesn't kill anyone. With running and any form of physical activity, their the cardiovascular fitness will improve.
Correct.
But if they have underlying heart disease, or if they are predisposed to any of cardiovascular events, so that need to be ruled out.
That get aggravated.
Yeah, that can get aggravated.
Absolutely.
So you need to screen yourself before indulging into any kind of a high intensity sport, because running is a high intensity sport.
Absolutely.
So you have to get yourself you should do regular checkups, maybe annually, before you prepare for any big event. So that is very important. And also you should space your events in such a way that you should not do all the runs at a very fast heart rate.
Correct.
So you can't do your personal best every weekend, because winters you have so many events. Every weekend is an event. You can't do your personal best in every. You need to give time for your heart to recover.
Correct. You can't keep pushing.
Yes. So I think those kind of unstructured running lead to all these kind of problems.
Another thing that usually is said is that fit people don't really need the checkups. It's only when I'm unwell is when I'll go, and that's the typical.
So that is again we need to change that sort of mentality.
Yes.
So we have seen in my practice in last 4-5 years, I have seen at least 5-6 athletic people, recreational athletes, those who are into gymming and running. and they were not having any chest pain or anything on running, because when you are running, you develop collaterals.
Correct.
The new vessels formation, that is called as the natural bypass, and you may not perceive that kind of a pain, but you may feel that you are getting fatigued early. So initially you were running 10 kilometers, now you are not able to even run 5 kilometers. So that is the first sign. Early fatigability.
Correct.
And then you are having breathlessness. I was running at the pace of 6, I was all right, but now at pace of 6 I am feeling breathless. So these are the red flags. These are the signs.
Correct.
Why I am having this chest tightness when I am running? Why I am having this jaw pain when I am running? So these are the red flags you should not ignore. Immediately you should consult. You immediately get yourself checked. Because these are small things which we tend to ignore, and eventually they lead to a bigger event.
And we need to be extremely aware of any bodily changes that are happening around.
So heart can cause pain in the chest, it can cause jaw pain, you can start feeling easy fatigability, then breathlessness, you may have palpitations. So all these are some of the red flags which you should be watchful when you are running. Correct. Which may not be present, but now you have started feeling it.
Yes.
So these are the new signs and symptoms which you should be aware.
Extremely aware of in your body.
Yes.
And also, another thing, when we talk about monitoring, the thing that usually comes to mind is that ECG is enough.
So ECG is a basic test which can tell you, which will give some information, but you need to evaluate structural and the functional capacity of the so the structural part will come to know with the 2D echocardiography, or if there is any structural defect.
Correct.
So sometimes it get reflected in the ECG also, but sometimes ECG can miss out on many things. So ECG, echo, and then to determine the functional capacity and to see whether there is any ischemia, whether there is any doubt of any blockages in the artery, you make them perform a stress test. Then you see if there is any ECG changes, if there is any arrhythmia when the person is doing a stress test, any abnormal beats which are coming while doing the test, and then after finish your treadmill, immediately you again do a echocardiography to see if there is any wall motion abnormality, if the heart beating is that heart pumping is increasing or decreasing. So all those things you need to so you need to check the structure also, the function also. So that can be done by echocardiography, stress echocardiography, and cardiopulmonary exercise testing.
Okay, so ideally all of these 4 should be covered.
Not all of these 4, depending on the patient profile. We cannot give all tests to everyone. So it all depends on patient to patient.
Level and
what level, what is the age of the patient, what are the risk factors of the patient, whether the patient is having high, so there is a scoring system.
Correct.
There is ASCVD scoring system, there is QRS3 scoring system, where you put all your parameters and you can determine whether what are the chances of getting your heart attack in next 10 years. So if the chances of getting heart attack is more than 7.5 or 10, then you need to be more extensive checks. Yes.
Another thing that that's posed to runners very regularly by non-runners is that marathons cause heart attacks. So myth busting of that.
As I told you, marathon doesn't cause a heart attack, but obviously if someone who is following unstructured training, or if someone is having underlying heart disease, or if someone is genetically predisposed to develop any sort of arrhythmia, then eventually it will aggravate. Then also you have to be very mindful of your of your nutrition on the day of run, also on your fluid, on your electrolytes, on your hydration. It is very important that you, if there is severe dehydration or heat exhaustion, that can also lead to electrolyte imbalance, and if the patient is prone to get for arrhythmia, they can, because of the electrolyte imbalance, they can develop arrhythmias and sudden cardiac.
Correct.
So it is, all these things are very important when you are, so you have to, when you are running a event which will last for 3 to 4 hours, like a full marathon, or someone who is doing half marathon, they should take care of their hydration. So they should at least, they should know how much water requirement, because they are doing long runs on their weekend, so they should know that what is their fluid requirement when they are running for 2 hours, and accordingly they should plan their
and electrolytes and so much. And most of the times in India, we are running in weather conditions which are against us.
Yes, against us. So you prepare in winters, and then TMM you run in a hot temperature. So once you go there, you need to adjust your pace according to the weather. You need to because here you may not have much sweating, but there you are going to sweat a lot. So your hydration plan will change.
Your electrolytes
will
that
change.
Much more critical.
And you just can't keep sipping only water. That will even lead to further hyponatremia, because sodium loss is happening. And if you keep taking plain water, it will further lead to it will further lead to hyponatremia, and hyponatremia is again dangerous. It can cause a lot of trouble.
Correct. Let's talk about heart rate monitors and smartwatches. Do they really help detect risk?
So these days, smartwatches like Apple has come up with,
heart
monitoring, so it can detect atrial fibrillation. So that is a good function. So endurance athletes, those who are triathletes, those who have been running from last 10 years, so they are more prone for getting, this kind of irregular rhythm, atrial fibrillation, because of enlarged size of their upper chambers, the left atrium and the right atrium, they enlarge. So that sometimes, when you do such intensive training for more than a decade, so eventually your heart becomes enlarged. So sometimes, with progressive training, in the enlargement occurs in such an extent that it can lead to some sort of fibrosis and scarring in the heart tissue. And those scarring, can lead to these kind of abnormal rhythms later in the life. So smartwatches, they can detect that kind of rhythm. It will, if there is any irregular heart rate, it will show a warning sign, abnormal heart rhythm. So at least it will give you some trigger that you are having. So many patients, they call me, runners also, that there is an alarm buzzing on my watch which is showing abnormal rhythm. So in that case, we advise them Holter monitoring, to check rhythm for 24 hours. Sometimes we advise them even for 48, 72 hours also, because you may not detect that event in a one day. You may detect it in 2 days. Yes. So we do it for 24 hours, 48 hours, 72 hours, sometimes for a week also. So those who are very serious about their running, and because we want them to have a safe approach. Absolutely. We don't want them to risk their life also.
Correct.
So Holter monitoring, we advise them for. So gadgets in some way, and so all the gadgets, they will monitor your VO2 max. So this is the trend of the VO2 max. So if there is an uptrend in the VO2 max, then one can feel motivated. Yes, I'm improving on my.
Better.
Yes. So it gives you some sort of tracking thing that you're doing, and also some watches, they will say your recovery time is this. So it becomes little bit. So those who are solo trainers, those who are not following any coach, at least they can get some guide from these kind of gadgets, and it keeps them busy also.
I think that's the larger that's the larger purpose.
So they have app where they
something
can check
something to look at after every run.
And feel motivated. So I feel gadgets to some extent they are good.
And they at least work as an alert system.
Yes.
If, like you said, if there is a first marker for a condition.
So for many runners, it is like if the battery gets drained up, oh my God, I am not running. I can't run.
It's a race run. Let me go back to this.
So it happened to me. My watch was not charged, but I was supposed to run 35 kilometers that day. So I opened up my Strava without any heart rate monitor. But that was a very good run.
That would have been a good run.
Yes, because I was not looking at my heart rate.
Correct, exactly.
I was just running with the feel. So that is the way to run actually. You run with the feel.
Absolutely. The joy of running is that only.
That only.
Correct.
So so during my initial days of running, I was like, I have to do sub 2, I have to do 140, 150, But now my motive is not to get tired after end of the run, and to enjoy run. So I do keep some modest, goal for an event, but still I feel that with your moderate and your before reaching your anaerobic threshold, so that kind of heart rate, na, around 155, 160,
Correct.
you maintain your pace of around 6. So that pace is individual based.
Correct.
So it depends on their endurance. So my endurance, my moderate pace is around 556. So I love running on that pace.
You're a fast runner.
I don't mind being a slow runner also.
You're being extremely modest right now. That my average endurance pace is around 550.
So that is my. It used to be before COVID, before entering into ultra, So after entering into ultra, my pace came down.
You can chase only one goal, no?
One goal.
Either the pace or the distance.
Yes.
And on you absolutely can't do both. So depending that
So
year, what is it that you
keep
chase?
experimenting on myself. Now I will try this kind of thing or try this kind of thing. So that gives me a lot of learning also.
Yeah.
And with those experience, at least I can tell my people, those who are running, I can guide them also. Okay, you should do this. Will work this way. So it is better to experiment on yourself and then set an example.
That's the way doctors approach. Very scientific.